Hello, my name is Adelheid Pinwell, and this is my oral presentation for Health 698, which is the Practicum class. Today I will be talking to you about the overview of my Practicum. My Practicum was performed at the Green Lake County Health Department, and I focused on the Comprehensive Community Services Community Support Program Wellness Group. This wellness group was created in the summer of 2017 for adult individuals who are currently enrolled in CCS, which is Comprehensive Community Services, or CSP program, Community Support Program. The adults that are enrolled in the program are usually suffering from some type of mental health issue, drug abuse, and they live on very low income, and they are residents of Green Lake County. The health unit realizes that the adults within these categories are overweight and or obese and live unhealthy lifestyles. The two social workers within the behavioral health unit determined that these lifestyles could be prevented or better managed with improved nutrition and physical activity, which is why the wellness group was started. The CCS-CSP Wellness Group is providing opportunities for socialization, teaching positive coping skills, exposing clients to new activities, increasing their overall wellness, and adding some structure to their day. These wellness groups meet every other Thursday in 8-week sessions. And for the first 15 minutes of the wellness group, there is a wellness topic that is presented usually by the health unit. I was able to present 4 of the sessions for a topic related to nutrition. The topics do range from healthy eating, dental and skincare, sleep hygiene, healthy relationships, basic budgeting, and much more. And after that, there is a healthy snack that is provided by the health department. And then there is a 30-minute physical activity session. On the next slide, we will talk about the practicum purpose. The purpose of this practicum was to determine how effective the wellness group is to the wellness participants. Considering that the wellness group has been going on for almost 2 years now, the health department felt that they needed some more evidence-based research to see how effective the wellness group has been for the participants. It also will allow feedback from the participants, so we can see if we can tailor it better to the people that are attending it so that they can get more out of the group. And like I said, they need to create evidence-based data to effectively apply for grant money to continue the wellness group. So this is a grant-funded program. So without the grant money, they will not be able to perform the wellness group. On the next slide, we will talk about the design of the practicum. So what I did was my preceptor and I developed a survey of 10 multiple choice questions. We wanted to center the questions around the topics that were presented within the wellness group sessions and physical activity, because basically the wellness group is centered around physical activity and nutrition. So these questions were centered around nutrition, physical activity levels, sleep levels, and how socialized the person felt, and if they felt supported at all in their life. And this survey was given to clients who were either participating in the wellness group or not participating by the social worker. So we were able to see the difference between the answers of somebody who was participating in wellness group and somebody who was not participating in wellness group. On the next slide is the accomplishments of the practicum. So overall, there were 13 completed surveys that I received back. 6 were from participants in wellness group and 7 from non-participants. Every group that I was involved in with the wellness group did have around 6 people that attended every session. So that was good that everybody within the wellness group, at least for this session, completed the survey and returned it to us. My preceptor was really happy about the number of surveys that we received back, because in the past they have gotten back a lot less surveys. One thing that I did want to note in these surveys is there were not many differences between physical activity rates, nutrition education rates, and sleep levels. So that was something that the health unit is going to take into consideration and develop a stronger nutrition and physical activity program within the group, so that those answers can be different between participants and non-participants, because it did seem like the participants in the wellness group were not really experiencing much of a health change when it came to nutrition and physical activity. We did notice that in the results of the survey that all participants of wellness group who completed the survey stated that they felt more connected and supported because of the wellness group. So that is really important when you're dealing with people who are, they have a mental health issue, especially drug abuse, substance abuse, and low income. It is very important that they feel connected within the community and that they are socializing, because that's very important for recovery for drug abuse and substance abuse people, and it is important for mental health people because they need that support to be able to better their life. And a good thing from these surveys was that the feedback from participants will help the health unit provide better education and resources in the future. So at the end of the surveys that were completed by the wellness participants, we asked them if they feel like they learn something new every time they attend, how they would like us to present the nutrition topic. So we gave them options of, do they like PowerPoints? Do they like handouts? Do they like hands-on activities? There was one wellness group session or meeting where we did teach them how to make protein balls. So some of them really enjoyed that. Others just like handouts and just like us to talk, because sometimes they are not the most social group. So some of them just like a little note that they can take home and look at later. And then on the final slide is the recommendations. So for this practicum, we probably should need a larger sample size to determine how truly effective this wellness group could be. And we do need to also look at how the effectiveness could vary between health departments depending on geographical location. I am in a very rural, small town. The town is about 1,500 maximum people, so that makes it difficult because it could be potentially a lot of a different effectiveness in a larger town or county, such as Milwaukee County. They have 4 different health departments. So this wellness group could have a different impact on that county because of how much bigger it is. And more advertising probably could have been something that I was thinking about in regards to this practicum. At each session, I could have considered that I could have said more about the survey and what I was doing, and to try to get it to become more effective. So those are my recommendations. Overall, this practicum was a really great experience. I really enjoyed getting to know the people within the wellness group and seeing their faces every other week, and somewhat noticing more of a social aspect within the group from the first group to the 4th time around that I met with them. They were a lot more social with me. I learned how to interact with people like that. And it was a really good experience, and I'm hoping to get a job at the health department and be more focused around helping people like this. So thank you so much for your time.